Do you think it's a good idea to pick up one of these? It could lead to hepatitis C. Do you think it's a good idea to do drugs? It could lead to hepatitis C. Do you think it's a good idea to share a needle with a friend? It could lead to hepatitis C.
So what is hepatitis C? Hepatitis C, commonly referred to as Hep C, is a viral infection that causes problems for the liver, which is the organ that filters and regulates blood among many other important functions. Problems like inflammation and scarring, if left untreated, can result in cirrhosis, which is an excessive scarring of the liver, or even liver cancer. This is different from Hep A, which is a mild infection contracted from contaminated food or water. Most people recover with little or no liver damage. Hep B is more serious and is commonly contracted from sexual contact or shared needles. However, both have vaccines available. Hep C is curable with treatment, but there are no current vaccines to prevent it.
How does the virus spread? Hepatitis C is commonly transmitted through infected blood. This means mainly unclean needles from shared drug use or shared needles at tattoo shops. Before the discovery of hepatitis C in 1989, some people would get it after a blood transfusion. After its discovery, screening for donors and medical practices were quickly put in place in order to prevent hepatitis C from spreading. Some less common ways of getting hepatitis C are sharing hygienic supplies with others like toothbrushes, razors, or nail clippers that may have infected blood on them. Transmitting hepatitis C through sexual contact and pregnancy are very rare but still possible. There is no risk of spreading it to the baby if the father has the virus. The baby is only at risk during pregnancy if the mother has hepatitis C prior to or contracts it sometimes during the pregnancy. If the mother has it during the pregnancy, the risk of the child contracting it is about 5 to 8%.
How is hepatitis C treated? There are no current vaccines for the virus, but there are ways to treat it. Direct antiviral agents, or DAAs, are medications that have over a 95% success rate if Hep C is diagnosed early. These medications specifically target the corresponding viral proteins and prevent the virus from replicating in the blood. After being diagnosed by a doctor, patients can expect to take prescribed medications daily for about 12 weeks. If someone develops chronic hepatitis C or has suffered severe liver damage from it, liver transplant surgeries are considered. Getting tested for Hep C is extremely important because it's what's known as a silent infection. This means that people may be infected but will not show symptoms for months or even years after having it. However, common symptoms may include easily bruising, easily bleeding, jaundice, and discolored urine. The CDC, or Center for Disease Control and Prevention, recommends that you should get tested for hepatitis C at least once in your lifetime. And if you think you've been exposed to Hep C, make sure you get tested.
Did you know hepatitis C affects over 58 million people worldwide, and over 45% of the total cases are predicted to be undiagnosed? Some estimates suggest that as much as 2.8% of the world population is infected. The virus that causes hepatitis C is known as HCV, which stands for hepatitis C virus. Research shows that HCV is more common in men than women, and dozens of studies suggest that more men are infected due to having higher usage rates of illegal drugs. July 28th is World Hepatitis Day, the birthday of Dr. Baruch Blumberg, who discovered hepatitis B in 1967 and developed a vaccine for it in 1969. HCV is the first curable chronic viral infection. If you are treated, you can be reinfected.
Hepatitis C is a highly viral and dangerous infection that can cause severe liver problems if not treated quickly. While it is treatable, there is no vaccine, so to prevent yourself from being exposed, don't do drugs and get tested at least once in your lifetime, as most people who have it are undiagnosed. Thank you.